Well, let's get straight into the first descriptor, shall we? This will take a while. I'm going to come back to other blogs in regards to how these descriptors work individually for certain different scenarios and for different functionality difficulties. Okay, but for cooking, let's start off with some of the language. Unable to lift heavy items due to seizures, due to the inability to bear your own body weight. Okay, scalds, spills, cut to fingers, injuries. Okay, unable to follow a recipe, has no danger awareness, will put my hands into an oven without an oven cloth. I lack danger awareness, or they lack danger awareness. Okay, unable to follow written word, unable to follow a recipe, therefore putting me at risk of malnutrition. Becomes easily distracted, will forget their cooking, and next minute you will have a kitchen fire. How many times has that happened? How many close calls have you had? The list goes on, but the most fundamental things are the language I've just used. When doing this application form, do not have a diatribe of blah 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 blah. Keep it factual. My carpal tunnel causes spasms in my wrists. I am unable to grip objects, therefore trying to lift a heavy hot object out of an oven will cause me to spill. I can become easily distracted. I have burnt food many times. That is a language you need to be looking at. That is the type of thing that you need to be considering. Also, things like I live off a microwave meal. That is not balanced nutritional meal. If you do not eat properly 4 days out of 7, okay, then you are not cooking. Okay, if you only cook 3 days out of 7, that is not cooking. Okay, cooking is over 50% of the time. This goes along also about what I was saying about adult social care assessment of need. Okay, it's different from assessment of need for physical aids and adaptations. This is more to do with you can't cook, you are at severe risk of malnutrition because you cannot cook and you cannot prepare a meal. Okay, I would also suggest that you get evidence of this. Adult social care, don't tell them about it's about benefits, but they will give you a report after the assessment. That report could be crucial in regards to helping these decision makers come to an informed decision in regards to your ability to cook. As I said, I've given you a lot of words. There are a few other words that possibly can be used for cooking. As I said, these words alone will not get you your application. It's about how you write them down and how you apply them. And even after this, at mandatory reconsideration, it would potentially need to be reworded again. Try it on your own, but why cause yourself more distress when there is help out there? I suggest the help knows how to use these words and they can put it in a more articulate way than you will and get this stress reduced than getting it extended for you. As I said, these blogs are free. I don't profess to know it all. I've never said I know it all, but I've been doing this a long time. That's about it on this. I think I'm trying to think of other language I can do, but it's burn, scalds, wooziness, losing consciousness, slips, spills, unable to hold heavy utensils, unable to follow a recipe, unaware of danger awareness. Lastly, also don't forget your fatigue. You're permanently fatigued. You're always in pain. these affect your ability to function. I hope this has helped. I'll wait to read the feedback. Thank you.